Я прокидаюсь, розкриваю свої очі. Спасибі тобі, очі, що я поки що бачу. Хай хтось говорить, що я ніби невдячний. Бути слабозорим, то зовсім не лячно. Так буває важко, коли тебе не розуміють. Думаєш, нащо вони вселяють ту надію. Так буває пекло, приходить серед вулиці, розмита акварель, нечіткі олівці. Я беру червоний колір, малюю протести на тому заборі, за яким тобі чудесно. Подивись навкруг, чи не бачиш ти там цей чудовий світ у всіх кольорах. В тебе є голова, очі, ноги, руки, не втрачай свій час. Працюй над собою, це не просто слова, це не просто наука. Ти старайся і скоро полетиш крізь зорі. Просто вір у себе, друже, так як я у тебе вірю. І не плач, коли тобі погано. Нехай навколо світ здається сірим, але це не так, насправді світ сам по собі безбарний. Просто вір у себе, друже, так як я у тебе вірю. І не плач, коли тобі погано. Нехай навколо світ здається сірим, але це не так, але це не так.
І ніби мій птах такий, як всі літає, там не видно всім, хай сонце не таке, не страшно, перебиті крила нехай, ти лети вперед, духом не падай, просто бери, видихай, і знову вдихай, моя пташко.
Я сказав, що світ безбарний, але то лиш розмальовка твоя, якщо він тобі не гарний. Спробуй почати все з нуля. Я сказав, що сірий колір, тож твоя сіра душа. Включай цю пісню на повторі, у кольорове майбутнє рушай.
І ніби мій птах такий, як всі літає, там не видно всім, хай сонце не таке, не страшно, перебиті крила нехай, ти лети вперед, духом не падай, просто бери, видихай, і знову вдихай, моя пташко. І ніби мій птах такий, як всі літає, там не видно всім, хай сонце не таке, не страшно, перебиті крила нехай, ти лети вперед, духом не падай, просто бери, видихай, і знову вдихай, моя пташко.
So, good evening, welcome. I hope you're all connected now to the right language channel. It was just explained to you both in Ukrainian and in English. But if you missed that part, you speak English, there's more. You can go to interpretation in 2 different languages, and then you choose English or you choose Ukrainian as your language, because this is a bilingual webinar. So good evening, really happy to be here with you. My name is René Kiet. I'm the chair of the European Community Mental Health Services Network. And we have this series of webinars. We do this 4 times per year. We have a webinar and we call it the Learning from Each Other webinars, because we learn a lot from each other in how we deal with mental health and community mental health in different countries. And a country that has really become very dear and has been the highlight of my working life in the last 2 years has been Ukraine. I've been there 4 times and become involved also in training on community mental health, been become very much connected to the Oblast Zakarpattia in the west, to the situation in Lviv. So it's really especially dear to me that I can now chair this session. And as always, we started with live music. And as you also know, the people who have already been to our webinars, we always have the opening done by a person with lived experience. And here that is the same person, because the person that you just heard singing, he's here among us. And his name is Oleksiy Skripachenko. And I know him, he's a person with lived experience. And when I was working for the WHO to support the community mental health training, he was the person with lived experience in that training. So I'm really happy, Oleksiy, welcome. Great that you are here with us. And my first question to you is, we just heard a song. Can you explain what the song was about?
Hello, everyone. Hello, Renee. I am happy to meet everyone. Yes, I'm a person with lived experience, and I am not ashamed to say that I have schizophrenia. As for the song, it is about the fact that despite the wings are clipped, my bird is keeping it keeps flying. And it is about the fact that we have to overcome all the challenges. We have to fly over them. So this song is about that. There is also a part about my visual impairment. Unfortunately, I am losing my eyesight. And I'm sorry that I took a pause, but I would like to tell you about the way I see the mental health services in our society, the way people talk about that. And as a person with the lived experience, I would like to share a few points with you. First of all, on my YouTube channel, Язикатись Весь, you know that I'm an influencer. I expressed this to my audience that I had a schizophrenia, and people responded in a good way. For me, it was an achievement, and you know, I took the load off my chest, and I can talk about that freely, and I want to talk about that. And probably, if I can do that on my YouTube channel, in different social media, then probably I will face resistance and the relief for the society. As for the mental health on the community-based level, in Ukraine, in fact, this topic is very popular. This is what I can see from the society, but it is very slow when it comes to the lower parts of the society. But you know, our state also offers some obstacles, because there are some people who are ready to introduce changes, but there are some layers of our society which still have this post Soviet Union vision, but the difference between people who do something and who do nothing is really big. There's a big gap. Also, I joined the WHO program, which is about trainings, where I meet Renee, and these trainings are about community mental health teams. Probably some of you already attended those trainings. As I understand it, the WHO works on different trainings on mental health topic, which contributes a lot even to the Ukrainian culture, to the Ukrainian vision, to the Ukrainian reality. Unfortunately, the war has a big negative impact on this, and we have a lot of obstacles, a lot of issues in our country. So now it is the right time to talk about mental health. Another few words about the way I ended up working with the WHO. I am a service user on the community-based level, so I already told people about this service, about the mental health community teams. As a person who went through that, it's a big achievement that the WHO and other professionals noticed that a peer-to-peer expert can contribute a lot to the development of this service, of these mental health services in Ukraine. I am grateful to you for hearing me, for listening to me, because we have to do it together. Thank you very much for this perception and for the fact that people start thinking about that and contributing to the changes.
Thank you very, very much, Oleksiy, for this introduction. Exactly the way I know you. You're a very reflective person. I didn't even know about your musical skills when we worked together in Kyiv, so that adds to it. And also a man of great resilience. The way you do, indeed, your openness shows your resilience, and also the issue with your eyesight. So really honored to work with you, and pleased that you want to give this contribution to our webinar this evening. And resilience is for me really a key word of the thing that's going on in Ukraine, because of course the war that's going on has a deep impact on mental health. But in the same time, I see this very strong, resilient movement of wanting to change mental health care, within this time of war. So since the full-scale invasion, in fact, has been more focused even on development of mental health care. And that has really deeply impressed me in my visits there. So we want to share a little bit of that journey with you in this evening. And first we will go to what happens at the government level, because there's an all Ukrainian mental health program in which different ministries play a role. And we want to start with that. After that, we will focus on one specific area, the area, well, that I've come to know also the best in the West, the area of Zakarpattia. And after that, we will go to the situation in Lviv, and you will learn about the Mental Health for Ukraine program. So that's the first hour. If you have any questions or comments or feedback, there is a section on this. You can see the question and answer. So please put your questions there, because the second part of it, after another round of live music of Alexei, we will have the availability of the speakers here to answer your questions, to answer your feedback, so we can get to an interactive part. So don't hesitate. Any thought that comes up, put it in the question and answers section. But so now the first topic is going to start now, the All Ukraine Mental Health Program. And I see two colleagues already sitting there together at a railway station in Kyiv, of all places, at the moment, but they can present it from there just as well. We're all flexible persons. So I see Olga Gorbaneva and Taisia Simoshko. I'd like to give you the floor.
Dear colleagues, I'm happy to greet everyone here. Thank you very much for having me here, for your constant support, for the fact that you've been supporting Ukraine for a long time, that you organize different events, which is very important. Apologies, I will not be able to be present during the whole webinar because we are going on our business trip. So I will be very quick about the All Ukrainian Mental Health Program, which was initiated by the First Lady of Ukraine, Olena Zelenska. And then my colleague Taisia Simochka, the coordinator in the Zakarpattia region, will take over. We can talk a lot about the mental health, but for Ukraine, the All Ukrainian Mental Health Program has become a big social transformation. It has been greatly noted that we still face that post-Soviet tail, which we have hard time cutting off, overcoming that stigma and putting the psychoeducation first. But as of today, the All Ukrainian program is not waiting for the... Sorry? Can you say a bit louder? So, and today we've already made a few steps, and we can see the results that at the national level, all the ministries are engaged into that program. Every ministry has the relevant minister responsible for the All Ukrainian Mental Health Program. The same goes for the regional level. The deputy governors, the designated deputy governors are responsible for this direction as well. And we can see the growth, the development in this direction, the way people utilize the services. And back then, before, we were sure that, for example, mental health is about protection, but now these services, they stem from different spheres, from different fields, from sport, from education, which is a unifying fact which brings us all together around mental health. And now I'm giving the floor to Taisia. She will walk you through the program at the national level and the way it's transported at the regional level. So in order to complement
my colleague has told about the All Ukrainian Mental Health Program, I want just in more details explain how the All Ukrainian Mental Health Program works. And what is really important to say that now we are at the stage when we want to work with the people and provide the services when the people are not diagnosed with some diagnosis, yes, with the mental health disorders. We want to provide the support and help to the people at the early stage when they are just having some anxiety, first signs of some mental problems. And that is also why the mental health program, All Ukrainian Mental Health Program, is designed to be integrated as a part of all policies at all levels. And the partners in this process are different international organizations. The partners, the ecosystem which builds the system of mental health program, contains all the possible governmental, non-governmental organizations, private persons, persons with the lived experience, and also the different communities, different regional and local organizations. So this includes all possible partners which could be involved into the mental health program realization. And what I also want to mention that the All Ukrainian Mental Health Program is not only initiative which is developed and implemented by the some authorities. It is initiative which is supported by the governmental programs, and the whole governmental is working together to work on the agenda and mental health programs and initiatives in the different sectors. So when we are speaking about the priorities of the national level, each ministry has have some so-called priority project, which is dedicated to the mental health issues. So if we are speaking about the Ministry of Health, it's most commonly like seen that the mental health is a part of the health, and that is also why it is like usual for all the people to understand that it is in the frame of the Ministry of Health work. But now we are combining together all the possible ministries. It's a Ministry of Education, it's a Ministry of Culture, it's a Ministry of the Veteran Policy, it's a Ministry of the economic also. So the point is to integrate the mental health topic into the policies of the different ministries, and in the process to build this common system which will provide the services at the different levels. Olha has already told few words about the national level of the program, about the structure of the program and integration of the program into the regional and local level. This is the scheme, how it looks like. So we have the coordination center, which is the main body, the main organization who is coordinating all the activities and projects together, communicates with all the dedicated ministries, and builds together the agenda of the mental health program in Ukraine. We have the state regional administration, and this state regional administration, as Olha have already told, every regional state administration that has one deputy head of the regional state administration, which is which is dedicated to the topic of the mental health. Of course, he is also working with the other topics in the state military administration, but one of the spheres of the responsibility of the deputy minister is also the mental health. And in each region works the regional coordinator, who is responsible more about on the coordination of the work of the different actors with the state organization, with the state departments, and build together the agenda of the development of the services at each specific region. Most of you most probably know that Ukraine is huge country, and the situation in the different regions can differ very much. So this also allows regions to build flexibility in the development of the services based on the needs of each region, based on the abilities of each region, so on. And during the last 6 months, we had also integrated all Ukrainian mental health consultants at the local level. So in each region, it was 5 to 7 local representatives and so-called pilot communities. In general, it was 132 persons who were working at the community level to also build the system at the community level, to collect the knowledge about the actors and service providers who are working at the community level, and to create the map and also so-called road of the client to those pilot communities. Here you can see the let's call it already family of the regional coordinators, because we are meeting very often. We are like working on the common agenda. Even today, we will meet all together to go to the Mykolaiv to learn the experience of the Mykolaiv region, how the all Ukrainian mental health program is implemented into the in those communities, in the regional in general. So as I already told, what is new and what's presented like 1 week ago, it's a mapping of the services at the community level in the pilot Hromadas. So each community now have this document where all the service providers could be listed, and they could also went to the consultant at the community level to be also mentioned in this community level handbook, to make all the services at the community level visible, and to be able to refer the clients from the service to the service. Because as I already have told from the beginning, the main idea is not to provide only to those who need the mental health support as a clients because they have some kind of the diagnosis, but to all of those who just feel uncomfortable, who just feel some kind of the anxiety, who need some kind of the low intentional methods or interventions to feel better and to not be a client of the psychotherapist therapist in the future. So these services and the mapping of the services was including the mapping of the services in the health sector, social services, veteran policy, culture, religion and art, youth and sport, NGOs which are active and providing the services at the community level, other organizations, and also the digital instruments. And specifically, if we are speaking about the services, we are also providing the information to the people and trying to work with the stigma, because still the stigma on the mental health services is high, and we are trying to reduce the stigma within population with the different kind of the informational campaigns. So one of the very active trajectories which is implemented during last year is also implementation of the mental health program at the level of the family doctors, and it is actually the priority project of the Ministry of the Health, and we can see that a high number of the family doctors, GPs, and also the workers of the community health centers were trained in the MHGAP program and are able to provide services now. So the second big project implemented as a priority project from the Ministry of the Social Policy is the Resilience Centers. And it is also a community center which is created as a point to provide the low intensity services to the people at the level of the community, and they can come there to know more about to get more information about their own mental health, to reduce the stress, and to find let's say support by the same people with the same problems or by the specialists. We are also, the national program is also integrating the mental health topic into the educational services at each level, at the schools, but also we are actively working with the universities and implementing this topic and services at the university level. Psychological assistance is also able in the crisis and emergency situations. Under the All Ukrainian Mental Health Program, it was implemented, the psychologists were implemented as a part of the rapid response by different kind of the horrible events which are happening in Ukraine because of the war. And there are also other priority projects implemented by the different ministries, as for example, mental health in the workplace. So the employees are encouraged to build their own policies and include the mental health topic into the common work policies at all places. So more information could be found of the national platform, How Are You Come, where a lot of the different useful information and tips is allocated. So we are actually working on the cultural dialogue about the mental health everywhere, from each topic and every possible screen in every possible corner and part of the Ukraine. So you can see that, and even if you will travel to Ukraine, first thing you will see at the train station will be the posters of How Are You program. And I do love very much the words of our First Lady. When we will restore a person will restore everything. So we cannot rebuild the country just by rebuilding the buildings. We need to really invest into the people and invest into the mental health of those who will in the future rebuild the Ukraine. It was about the national level of the mental health program, but as a regional coordinator of All Ukrainian Mental Health Program in Zakarpattia region, I want also to tell more about the work we are implementing at the regional level. So if we are speaking about the regional level, I already showed the national center and how the coordination works at the national level, but at the regional level we can see that also we are coordinating all the time our work with the national level, but we are very intensely working with the different departments. The same situation as a national level. So some organizations, the national level is working with the ministries. We are working with the same departments who are representing those ministries. So we are actively working with the health department, Department of Social Affairs, Department of the Education Sciences, Youth and Sport, Culture, economical department, and also other service providers. We are also visiting and trying to connect a lot with the different communities. In Zakarpattia, there are 64 different communities. In 6 of them, we have consultants, which have already also mapped the services in own communities and which are working and presenting the program at the community level. But also at the regional level, we are actively working with the partners organizations. I am the part of the subcluster MHPSS, which is is organized by WHO. In Zakarpattia, we have own cluster, which is covering our region and Ivano-Frankivsk region. And also we are actively working with the different NGOs which are active in the region. These are 6 consultants who are working in Zakarpattia, and it is my small team which is also bringing the mental health topic and increasing the knowledge about the program and mental health in own communities. If we will describe it as a map, so those people are presenting all the parts of Zakarpattia region, from the west to the east and from the center to the very far away mountain region, which is 240 kilometers away from Uzhhorod. We are working at the regional level. We are trying to include in our ecosystem administration, departments, but also universities, international partners. And we are very grateful for all organizations which are providing the services in our region and which are supporting us in the development of the services and increasing the quality of those services. So, at the regional level, what are the goals and what is the vision of the development of these services? We are trying to identify the gaps. We are trying to find the possibilities to cover these gaps, to create the new services, to create the services at the communities or in level in those communities which have less developed mental health services. We are trying to connect the partners, international, national, governmental partners and non-governmental partners in one framework to build the common vision and also to build the common platform for the development of the services in Zakarpattia region. So we are also trying jointly response to the needs, because maybe some partner will have resources, but he will not have access to the clients. And through the communication, through this platform, we are building the system which can approach every person who needs support and help in our region. Of course, we have a lot to do, because even the Zakarpattia region is one of the smallest regions of Ukraine, but still the population of Zakarpattia is 1.2 million of the citizens. So it's a lot of the people, and even more after the full-scale invasion, because we have a lot of IDPs, and also the topic of the returns of the veterans and building the mental health services for the support of the family of the warriors of Ukraine is also very actual. So we have at the beginning, we have also mapped some kind of the services in Zakarpattia region, and what we could see that every community has at least one service, yes? But what is one service when you, for example, need a different kind of the approaches, and you have a lot of the people who needs help, and you have only one school psychologist, for example, at the community, or only one GP who can provide the mental health, basic mental health support. So what we have also discovered during this mapping process, that the services in the different communities are not really at the same level of the development, and also the quality and distribution of the services should be improved. So together with the partners, we are working on the common agenda and also on the covering those needs in the different communities, which could not be covered by the community itself. But also we have a lot of the state support, because the national programs are built the way that the community can apply for the different kind of the support. And for example, resilience centers are created in communication and cooperation with the community level. When the community is providing the building, covers the running cost of the building, and the ministry is providing the payment for the specialists who are working in this building. In this kind of the services are very very helps a lot to develop the quality and the number of the services at the community levels. What we also do is creating and managing the educational opportunities for the different partners and for the workers in the different sectors. For example, the family doctors, to train the social workers, to provide the possibility for trainings for the teachers, for the cultural workers, for example, for the workers of the libraries, for example, and so on. So we are also trying to share the best practices to provide the people more information about those services and opportunities which are at the community level visible. Coherent development of the services. We are combining the efforts with the different partners. For example, there are some partners who can provide support to the communities to renovate, reconstruct the buildings when the services could be provided. And the community is taking care for their own about these buildings, and the state is providing the money for the service covering. This is how the service development is working. So we are also working a lot on the promotion of the mental health topic and providing the information at each possible level. And one of the topics which is very popular, and we are working it, doing it in all Ukraine, is Spilno-Dia. It's a joint action on one tema, same day, and all regions of Ukraine are making the same event. It's all about the All Ukrainian Mental Health Program at the national and regional level. I will be happy to provide the answers to your questions. And thank you very much, Renee, for this possibility and place to tell about it. Thank you.
Thank you very much, Taya, for this very thorough explanation of what's happening at the national level, and then focus on the area where you work. It is one of the person commented this relatively safe within Ukraine, but doesn't mean that the war doesn't have also a deep impact on Zakarpattia, and there's a lot of energy in the reform there. So thank you for doing that. You were able to give the whole presentation at the railway station, so we're really happy that you could do that. And we hope you will stay with us a little bit longer, even when you're going to board the train with your whole family, as we saw, of the regional coordinator of this program. But now we switch to the next speaker, Irina Roskovich, who will, she's also a medical doctor in Zakarpattia, and very much involved in the topic of community mental health, early childhood intervention. So please, Irina, take us along in your story.
Hello, everyone. Good evening. Dear colleagues, thank you for being here with us at the webinar. I am grateful to Renee for such an opportunity to talk about mental health care. For me, it is my lifelong mission, within the early intervention service. I will share my experience in our network in Zakarpattia. I know that I have very little time. That is why I will switch to the question. Okay, I will provide a definition about the early intervention. This is the family-oriented service for families who raise children with developmental impairments from 0 to 4 years. Can you see my presentation? Thank you very much. On this slide, you can see something. Some pictures and a word. Very often in these families, they seek support from us within the early intervention care. And our task, our service is to help people see themselves despite the severeness of the impairment. The family has to live the life that they would love to have without it. You know, this early intervention service is very specific because we are talking about our babies, about toddlers, about newborns. That is why we also talk about the mental health of babies, of our children, and what does the early intervention do for that? This is about the development of the natural potential of the family and of the baby. And as Eduard Vinnikov, the famous British pediatrician, said that the eyes of the mother is the first mirror that a child is looking at, and this is an important world for the child. It is important to have the good eyes. So, and for us to achieve that goal, we base our work on 3 aspects. You can see this triangle by Carl Dunst. These are the 3 components of our professional knowledge, which is very important in order to provide high quality service. This is also about building relations, because all of this is done among people, between professionals and parents, and to what extent this relationship will be open, will be trusting. It depends on the way we move into the same direction. You know, we have a shift in paradigm, and today we started our webinar in an unusual way, because usually we talk about people, about text, but today we were listening to music, to the music of the person with the lived experience. And you know, we also had a shift of the paradigm in the early intervention, because we regard not as a child but as a family, because yes, there is a child, but also the people around this childhood impact on the development of this child. And another component is the participatory practice, which provides for the active engagement of the parents into the decision making, because they are the first line experts about their kids' lives. After the outbreak of the full-scale war, this triangle wasn't that clear and defined. Of course, we faced difficulties when providing the service, because we are people, human beings. We are not superheroes. We are also worried, fearful, nervous, and our emotional state also exists, and you know, our meetings constantly flow with different information. But there are 2 important questions. How are you? And I do love the name of our All Ukrainian Mental Health Program, How Are You? But it's important to have this courageousness to ask, how are you? And the parents do that. Again, it is very unpredictable. What is happening now? What will happen in 1 hour? We heard that, of course, the Zakarpattia region is the safest, but you never know. And until now, when I hear the air raid alert, I am very anxious inside, you know, and worried. Different external obstacles and so on and so forth, these power outages, heating outages, so different obstacles which really gave us hard time. We provide services to the IDP families, and it is good that our region is relatively safe, and our task is to host families who are forced to flee their homes. Our service is provided by making home visits. We go there where the child is growing up, where the child lives, and we can see every aspect of their lives. And all of this is about their development. But of course, we had some difficulties with these home visits. Some parents, especially parents, IDPs, I mean, they were not quite comfortable because they are not at home. They are living in an apartment with other 3 families. And for example, we also attend preschools, and we help children there in their natural environment there. There is another format, which is the online service. It's like humor, which also helps us survive and look at the situations through different lens. But I always say that, oh, thank God that COVID happened before the war, because we learned how to work online. And then we call an online consultation just a normal visit. So if you have some issues with feeding your child or breastfeeding, okay, let's look at this online. Or we can, for example, pour over the test results online. But who helped us and what helped us? You know, our creativity, our resilience, our flexibility and adaptability to all the challenges and conditions. You know, I do like my colleague psychologist Natalia Bushko. We had a course about trauma-informed care, and she talked about resilience, and she said that it is also about optimism, not only flexibility. Ukrainians are very upbeat and optimistic. We have this hope which will never be removed. We are bonded with our parents. You know, we have common shared difficulties. We are helped, and our team meetings are really helpful, beneficial, because we share our stories. We receive new training opportunities. We know, for example, about PTSD, but we also know about the post-stress growth and development. We are living on the battlefield, but all these opportunities, they give us growth. They teach us how to develop ourselves and grow. You can see that the life goes on. We are training others and we are learning new things. We were training others. There are 3 national early intervention trainers, and we will keep training the other teams in the Carpathia region. Now we have 4 teams. We believe that we will increase this number because it is not sufficient in order to provide the comprehensive services to the whole region. But for this, we will need more than 30 teams. We also have and need supervisions. We are very happy that we receive the world support, and I know that At this webinar, we have Eric Bloom colleague. We receive and we have every week meetings, and Renee also joined them. It is important that we have this opportunity to talk about our state of affairs. We receive seminars, supervisions from our colleagues. For example, the ARC Foundation from the Netherlands, which also bolsters our personal and professional growth. It was really important to attend the trauma-informed trainings, and after that we will have the training for trainers, art therapy, music therapy, so everything available. Music is super powerful for healing people, and we also had a training on staff care because we work with people and we are running the risk of burning out, especially during the war. You know, I have heard this thing from one Gestalt therapist. You know, in order to survive, just to survive, you spend much more energy. And for this, we need to take care of ourselves. And the foundation AMNA also conducted the training. And we were so happy when we gathered with our team in Krakow in 2023. We got very resourceful in order to be able to provide trainings on their own. In 2024, I visited different districts of our region to hold different trainings on trauma-informed care for other specialists, for educators, for social workers. We provided this training for the rehabilitation center specialists. We share this knowledge. We have lots of plans for this year because it is in high demand and people are constantly interested in that. They are eager to learn something new.
Irina, can I go in between? I'm now aware that we had enough material for 3 webinars this evening. But yeah, exactly. But we do have another speaker. We also want to go to the situation of health for Ukraine. Not much more to tell. It really touches me also, this because I know many of the projects that you are telling about. So the only thing I can see that we record the whole presentation and put that on our video, but I really would like now that you sort of wrap up with the key message that you want to end with, so that we also then can do justice to the third.
Thank you very much. So art therapy and music therapy, we had different trainings for parents. It is very important when we are at a loss for words, we can make use of other means to help people, because safety is not the absence of danger, but the presence of communication. And we also have another supporter, the NGO Ukrainian Association of Early Childhood Intervention. I know that Anna Kukuruza, the president of the association, is also with us today. And of course, our joint achievements with the parents. To conclude my speech, these are the conclusions which are drawn from the study conducted by the Early Intervention Institute, supported by different colleagues, by different NGOs. And the functioning of the Ukrainian early intervention care and during the war, the partnership with the families raised to another level, and now we support parents and the parent support specialists. So this is the main conclusion, because partnership lays the foundation for the early intervention, and care about our relationship is the foundation for mental health. Thank you for your attention. I hope that I will answer all of your questions if there are any. Thank you very much for this opportunity. Thank you, Rene. Thank you, dear colleagues.
Thank you, and thank you very much, Irina, for your wonderful and inspiring presentation. It's really good to work with you, and hope we will continue to do that for a very long time. And this important of early intervention is so vital in mental health, because the way we organize mental health, we're always late when things go really wrong, and you must be there early. And the way you also in your center do that in a very humane, nice way. So thank you for that inspiration. We now go to Orest Souvalou, whom I met several times, and one time in his hometown, Lviv, but also he works at a national level with the movement Mental Health for Ukraine, a Swiss-Ukrainian project. So we really want to give attention to this very important project and your inspiring work in Lviv. So Orest Souvalou, you have 15 minutes for the presentation. We will shorten a little bit the music and then still have time for the Q&A after that. But please take your time for your presentation. Orest.
Thank you. Good afternoon, everyone. It's a big pleasure to be here. Thank you, Rene, for inviting me. So my name is Orest Souvalou. I'm psychiatrist by education, and now I'm project manager of Ukrainian Swiss project Mental Health for Ukraine. And thank you for possibility to present our project, because we now are realizing our second phase of the project from 2024 till 2028. And we began our activities from 2019. And project is realized by the consortium of organizations leading by GFA, German organization, with partnership with Zurich Psychiatric Clinic and Institute of Mental Health of Ukrainian Catholic University, is funded by the Swiss Cooperation Office. Also, we had as a partners in the first phase, our partners from UK, this company Implemental, with Graham Thornycroft and his team. And we began our activities from the development of intersectoral cooperation in the fields at the level of communities, and it was 2019. We began from the three pilot regions. This is Dnipro, Luhansk, Donetsk region, Luhansk regions, and Lviv region. But unfortunately, due to the full-scale invasion, we changed our pilot regions, and now we are in this phase. We are working in the Lviv region, Chernivtsi region, Dnipropetrovsk region, Rivne, in Kyiv region. So we began from the MH gap. We began from the cooperation. We began from the establishing the pathways, making a mapping, and using also WHO recommendation how to did it. And thank you today for presentation of Tanya, of Taisia Samochko, and of colleagues, because now this is like all country approach to make the mapping and the referral pathways. And in 2022, this instrument was very useful for the local stakeholders when a lot of IDPs appeared in the western part of Ukraine. So the possibility to see the services and where are they providing in some communities already existed. Also during the project, the first phase, we made a lot of different activities, and unfortunately, due to the limitation of time, it's not possible to talk about all our activities, but we made very good leadership course for leaders for mental health, 6 months course in 2021, and now I see a lot of these leaders are really active in the fields of mental health in a different level, social sphere, medical sphere, developing the services. We also, with partnership with the Institute of Mental Health and its publishing department, make a publishing activities like translated DSM-5, making some publishing books about the ADHD problems, and also supported forensic psychiatry, translating and introducing into practice ACR20 instrument. Also, we translated the protocols, how to work according to the NICE recommendation with common mental disorders, and many other printing materials. The last one is recommendations and international protocols for adults and children, and it is free available in the family circle. This is a medical clinic in Lviv, so it's in the website. It's possible to have this recommendations and protocols in the PDF. Also, during the first phase, we developed the website, the education website, and here you can look at the psychiatric lectures from Zurich Psychiatry Clinic, and also we provided 2 spring schools, which is still actual and very interesting, and we planned this offline, but due to COVID limitations, we made it online and accessible, available for everyone. Also, we launched the ambassadors program, and I'm very very happy because this is very acting peer support group, which is active developing, and we had some video presentations of experience of people, and also now this is living group, and last week we had a conference, like meeting of ambassadors, making plans for the next year and next steps which should be done. War and full-scale invasion like changed situation dramatically, and nevertheless, on all these challenges about what Irina told already, but the circumstances is really difficult, and we need to adopt to the new reality. And when in February 22 the full-scale invasion began, so we helped local administration, local stakeholders to adopt to the new reality. And then in Lviv region, we created the support to create the medical psychosocial group in the railway station, and also to build the network of coordination consulting centers at the rural areas, at the rayon levels. And here also you see the WHO scheme of support of organization of mental health psychosocial support network group, and we in our pilot regions coordinated these groups. I was involved in Lviv till the summer of 2024, because now the local administration already begin to coordinate by themselves. Also, nevertheless, on the difficult war times, in a project, we received requests from the local administration in our pilot regions about support of creation of mental health centers. And here you see the years and the number of centers that we supported to create. And now the national policy also changed. And now this is a part of the national healthcare approach to create the mental health centers, and the National Health Services is already funded this. And even today, First Lady visited in Dnipro region, you see the number 1, because in this region, we supported 1 center, mental health center, and today the First Lady, Olena Zelenska, visited this center, and this is like very good sign that state and the First Lady and the authorities are very attentive to the mental health sphere. Also, during the war, we saw the need of not institutional care for people with severe mental disorder, intellectual disabilities. And here you see the numbers of people living in supported living facilities. So this is like alternative approach to the internat care. And I think René, Eric, and colleagues very good aware about this type of institutions. And this is also the heritage of the Soviet time. And we met the huge movement of evacuation of this huge institution after full-scale invasion, why this is like the possibility to develop the alternatives. And now also Ministry of Social Care have already the vision, the strategy of deinstitutionalization, and this is also very good, and I think it's promising to develop alternatives to the institutional care. Also, what we did during the previous times, this is supported the existing services, because we also understand that conditions in existing psychiatric services are not always like very good and very good conditions. So why we decided according to the request, according to the existing leadership, to develop the rehabilitation sphere, rehabilitation place in psychiatric hospital in Lviv, where now there are different options to provide psychosocial rehabilitation. And I'm very thankful that Rene visited this and saw it, how it exists, how it works. So also, the supported living facilities existing in Lviv, this is now the real situation, a real home for people, which is possible to look, to analyze, and we also are planning to make some research to look how the services exist, but it's already the possibility for some people not to live in the closed institutions, but to live in communities. And here you see the NGO Майстерня Мрії, Dream Workshop in Lviv city, also Caritas Stray. In Stray opened 2 houses and 1 apartment with 20 inhabitants, and I think this is examples how these services should like in communities. The last service that we supported was opened in Fastiv, this is Kyiv region, and yes, this is also like possible not only in the Western Ukraine, but in the other our pilot regions. But when we are supporting services, we are looking very carefully for the good leadership and the sustainability of the services. And sometimes this is challenges to really provide some other type of services. The other directions that we see, and I also would like to talk that this is not all our activities, but we saw very important needs in the communities. This is work with families who are living with ambiguous loss. And here you see the example and also like publications that could be is available to read about our work with relatives of missing in action soldiers. And this is sometimes not very good visible people at communities. So now this is movement also of the peer support groups in our pilot regions. And also like last autumn, we provided the trainings for the clergy about this, because also people are not coming to the formal services. Social, medical services, and the priests and clergy is very important stakeholders here. So why we also began this type of training activities to explain people how to communicate and how to provide some support from the clergy side. To be like much more clear, we are operating in 3 directions, and with close collaboration with How Are You coordinators in the field, and I'm very thankful for them and for First Lady for this movement, because this is people who are in the fields, like also providing this First Lady initiative in mental health. And here we are like working together, and we are planning to continue this cooperation to realize the action plans which are in every region, because national policy is also changed. We have the action plan of realization of the concept note of mental health, and every region developed these plans. And also we will continue to provide MHGAP trainings and other trainings related to different mental health points, like work with social sphere, work with those who are providing services for children. Also, we want to support the development and increasing the numbers of mental health centers, and advocating for supported living facility, and also living while waiting, the initiative for the work with people who are feeling the ambiguous loss, support first responders, and also local MHPSS activities, especially in the regions which are close to the frontline territory, like Dnipro region. And finishing my brief presentation, I just want to show that we are still living in war, and needs are increasing. Needs are very different. As Rene told, we are like not all the time, not in time. And hopefully Ukraine is much more visible now to the world, and publications appeared. We have the strong national support with ministries, with all national program. We have very good cooperation with WHO, and also ARC report here, which we provided with colleagues about the MHPSS context of Ukraine, because we understood sometimes that we are not very clear, understandable for the world because of some Soviet heritage and this like post-Soviet times. So we need more explain about ourselves, about the cultural peculiarities and the other peculiarities. But due to the war, the gaps are much more visible. We see also growing expertise and the growing capacities. Ukraine is also in the time of transforming of mental health and healthcare provision. So this is also the burden and the difficulties related to the mental health service provision, and we don't have to forget about the service providers to support them, their mental health, their self-care. And there are difficulties, but we see the possibilities, we see the support each other, and I think that coordination, cooperation, and like development of evidence-based services, which will much more better help us to deal with all these needs which are growing. And thank you for this possibility, René, one more time to have a word and to share our experience. Thank you all, and let's talk.
Thank you. Well, let's first thank you all for all that information, so inspiring, structured, and moving. But self-care within our webinars is that we listen to music to let it sink in. So we now have another song of Alexei. We can let it sink in. Then we have the questions. We will see how many we can deal with. Questions that we can't answer now, we will later answer on the website. But first, the music again of Alexei.
Я написав би пісню про кохання, але ця буде про любов. Нам сонце запалить бажання вірити у добро. Ман, як би не було нам боляче, стоячи, ми захищаємо дім свій. Як би не було безглуздих сусідів, то я не цінив би країну мрій. Відчуваєш, як тріпочеться душа моя в твоїх руках. Ти знаєш, почуваюсь ніби птах, двічі швидше, серце б'ється, знаєш, що не вічне, але поки ми тут є щасливі, тут довічно. Крізь сльози і біль, крізь смуток наших днів, я вірю в ціль і нашу перемогу. Ми про любов і доброту не забуваємо, проходячи життя дорогу. Було би прикольно писати слова про те, як вона співає мені колискові, про те, як дала мені доброту і любов. Але перо напише знов про військових. Хлопці, могутні бійці, наші захисники, спасибі, що не здаєтесь. Я вірю, що ви на своїй землі всіх ворогів переб'єте. Мої написані слова залишаться лише в архівах. Пройдуть роки, мине війна, ми повернемось у свої міста. Вже Маріуполь буде іншим, і світ побачить новий світ. На сході буде декілька сусідів, а не як зараз лиш один сусід. Крізь сльози і біль, крізь смуток наших днів, я вірю в ціль і нашу перемогу.
Well, thank you, Alexei, that we could listen to more of your music, and you have a whole YouTube channel with many more songs on it. This one really came, deep when I first saw and heard it. So I wanted this song to be here. So we have more questions, I think, than we can answer. But I want to start first. There was the question of already in the beginning of Lola Shribianets. On the treatment of substance use, and this of course an important theme in an integrated treatment. Oris, can you answer that? How's that? Well, is it integrated or not? What's the practice there?
Yeah, thank you very much. It's very good question because the substance use is a real problem, and we know data from 2004 from the Evelyn Bromet research that it was the most spread problem among men in Ukraine. And now, due to the war, we also see the problems here. And Ukraine inherited the system of narcology services. This is like the separate line of services which are dealing with substance use, but also people with these problems are treating in psychiatric hospitals. And there are discussions, this importance to have the separate like narcological services, or this should be integrated. But as I see now, more attention is paid to this. MHGAP, which are like already national program integrated into primary healthcare service provision, has this component of substance use, this module. So the family doctors are more aware about this. The promotion and the prevention should be done more actively. In here, we have also the movement. What I see in the Public Health Center of Ministry of Healthcare, they are paying more attention to this. And yesterday, I was at the meeting of Lviv Military Administration, where it's like this MHPSS coordinating group in the local administration, and the separate discussion was dedicated to the substance use in the region, and also it was joint efforts of the psychiatry, narcology, and also substance use rehabilitation centers. And church is also related here. So in the Lviv region, I see this movement towards better work with this problem. And at the national level, I also think that we need to more collaborate, and to have like separate probably program how to deal with this, because it still exists, and yeah, we need to work more on it.
Thank you very much. Then I want to go to the question of Erik Bloemkolk, and I see that Taya is still around, because there's also a question about, we set up a new type of care, community-based mental health care, but we also have the old institutions, and we have to invest in that. How do the two go together, and what is the place of that within the All Ukraine Mental Health Program? Can you answer that for us, Taya?
Rene, can you repeat the question, please?
Oh, well, the question was the question of Erik Bloemkolk. We create community-based mental health care, but we have the old institutions still as much there, and so invest in that. So, what's the part of the reform of the institutes within the All Ukraine Mental Health Program?
The All Ukrainian Mental Health Program, the institutions should be reformed, and also supported living should be implemented as a best choice for the persons, for the people with mental disabilities. And this is actually implemented by the Ministry of the Social Affairs. And we are also creating the new services for the families with the people with different kind of the mental problems. So this could also make like a better promotion for the people to live and to care about the people with the mental disabilities, and not to send them to the different kind of the institutions. So both the institutionalization of the mental health institutions.
Oh, we didn't think we made the train is now
and this kind of the internats, and also better services at the community level and better services.
Yeah, I think Taya's now in the train already, and so the Wi-Fi isn't perfect. I think we got most of your message though, and maybe if there's some additional information about this, about the place of the former institution like the internet in the All Ukraine Mental Health Program, we would happy to be posted on our website. Another important topic that came across in various presentations was the topic of self-care. And one of the people asked, to give examples of self-care. And somehow I think this is a question that I want to raise to you, Irina. That how do professionals also can look after themselves well? What is your advice in there? What are good examples of that?
Thank you very much for your question. Self-care has to be embedded into our routine to become our usual thing, as our colleagues shared. Just make a list what makes you resourceful. Because when a person is stressed, is anxious, they can forget these things, these simple things which can be done, which can be embedded into your everyday life. For example, I keep my diary, and my psychotherapist mentioned that I have to write down what I achieved, what I failed, and then it becomes your habit. So you should start with something small every day. You should remember that self-care is not about egotistical. I heard about it from Edith Hager. I know that you know about her. She's a very famous psychologist, psychotherapist. She wrote a book about the choice, and I heard from her that self-care is not about being egotistical. We cannot give if we do not receive. So one hand gives something to others, and the other gives something to yourself. So you should fill your cup and restore your batteries. This has to be your daily routine. You should take care about yourself. It depends. I love art, music, which gives me growth opportunities.
I just want to add
work.
a few sentences to this. So you can try to use also different kind of the breathing technique, but also on the webpage of the All Ukrainian Mental Health Program, you can find the first 8 mental health self-help techniques. So it's really very easy to understand and useful resource to find the techniques which will suit you personally. Techniques, different possibilities, and you can find those which will be good for you personally. And also subscribe on the social messengers of the All Ukrainian Mental Health Program, because each day there are some publications with very easy techniques which you can use daily in your daily routine. It doesn't take any time, it doesn't take any efforts. You can just take it and use it, and it will be helpful for you, I can assure you.
Yeah, that's for sure, Taisa. Thank you for additional. And I would like to emphasize that those techniques are evidence-based. Everything what is on the website of How Are You, it's evidence-based. And we use it and we share it, of course, during our webinars. And I myself also have an app from How Are You. So it's really helpful. But you have to, prevention also, think of yourself and develop some new hobbies or old ones. Remember the old ones, which give you resource, and it's also individual.
Okay, well, thank you. So many more questions, so little time left. So as we said, we will ask all the speakers, we give them the questions and ask them to give their feedback on that question, and we will put it on the website together with a video recording. So of this whole webinar, you can look at it again, you can share it with others so that it can reach many people. Before I give the last words to Oleksiy, I first want to announce the upcoming events of our network, EUCOMS. So here's the slide. With that, we will have a seminar in the end of March in Greece about dealing with crisis. That's about the community mental health response to natural disasters. We are in an area in Alexandropoli where there have been very large bushfires. We also have psychologists from Valencia where there's enormous floods, and we hope to have speakers from Turkey with the earthquakes. And how that has major impact on mental health, and what's the response to that? What lessons are learned from that type of disaster? So very interesting. But then you have to come to Alexandropoli if you want to attend. You don't have to travel for the other thing, because as I said, we do these webinars 4 times per year. The next webinar will be on March 12th. The HELLO Declaration, HELLO is a place in the Netherlands where we did a workshop on peer leadership, the leadership of persons with lived experience, persons like Oleksiy, who have become leaders, and how can they develop their leadership. So that's the event that all can attend. Then I want to give the final word to Oleksiy Skripachenko to reflect on the webinar as it has been. Oleksiy.
Thank you very much for having me here. Thank you, everyone. It is a great pleasure for me. You know, I really can resonate with everything mentioned. And for me, it's a big pleasure to be here. What I wanted to add is that my dream is that everyone who goes to fortune tellers shifts to psychotherapists, to psychiatrists, so that the professionals can receive a decent payroll. And if I had a Soros Foundation, I will cooperate with the state and allocate a lot of funds in order to support healthcare professionals. Thank you very much.
Thank you, Jaco. Thank you all for attending and staying with us till the very end of this webinar. It was really a pleasure. And a special thanks, of course, to the interpreter, whom we haven't seen, but maybe you can put your camera, Tatiana, because you made it possible that we could communicate in 2 languages. So a big applause to our great interpreter. Thank you very much. And see you again at one of our next events.